First of all, allow me to recognize the presence of the ZMA executive and also the senior members of the profession that have joined us in this meeting. Also, let me recognize my dear colleagues. This evening, we have a topic uh, on postgraduate training in Zambia, basically looking at the various types and different choices of career paths that one can undertake. And we have a very special guest who is a consultant, orthopedics and trauma surgeon, also registrar of the Zambia College of Medicine and Surgery, uh, who has been my teacher from undergraduate as well as postgraduate when I was doing my orthopedics and trauma training. This is a man who is well known, also a former Secretary General of the Zambia Medical Association. Allow me, my dear colleagues, to welcome Dr. Jonathan Sitali, who will be the presenter this evening. Also, to moderate this discussion is our very own Dr. Mwila, well known and the chairperson for Medical Education and Research Board under the Zambia Medical Association. My dear colleagues, without wasting much time, allow me to call upon Dr. Mwila so that she can take us through the program and we can kickstart our discussion. Dr. Mwila, I submit. Thank you. Dr. Mwila, are you
Thank
there?
you very much, Dr. Ngwira. Good evening, everyone. Good evening to our presenter. All protocols observed. Thank you so much.
I don't know if it's just my network or is it that we can't hear Dr. Mwila?
Very important conversation we'll be having this evening. Me? Are you able to get me? Hello?
Yes.
Am I audible?
Yes, we can hear
Okay.
you.
Okay, thank you so much. Apologies for that. Good evening, everyone. Thank you so much for logging in and being part of this very important discussion that we'll be having this evening. Without wasting so much time, allow me to hand over to our presenter, Dr. Sitali, if you are ready to take us through the presentation that he has for us this evening. And after the presentation, we'll be able to go into our plenary session where we can feel free to ask our questions. Feel free to use the chat. Also, in case you feel you might forget your question by the time the presentation is over, feel free to post in the chat and we'll go through all the questions. Dr. Sitali, over to you, sir.
Thank you, Dr. Mwila, Dr. Ngwira as well. I recognize the ZMA executive. I recognize all colleagues on this call. Maybe should I just simply say all protocol observed. Now, tonight, our moderators have indicated we're talking about postgraduate training in Zambia. I'd like to start with posing a question. How does one choose a career pathway within medicine? I know, looking at the people in here, a lot of us are actually already specialists. But I also note that there's still a good number of my colleagues here who have not yet made that decision to become a specialist. Now, whether you're a specialist or not, that question still arises. You know, there are, and over the years, I've interacted with a lot of colleagues who've given me indication that, and I suppose looking at my own background as well, choice of a career pathway will follow things like, I enjoy a particular rotation, or this particular consultant so inspired me that I need to follow the route they have taken. Others, it's because you want to avoid rural posting. There's a program on offer, and they tell you if you come into this program now, you are not going to do rural posting. Or maybe it's because a scholarship has been made available to you. There are no fees that you are going to incur. There's a scholarship, it's a prestigious training institution, so why not? Colleagues, is this really how we should choose? Is this how we should make perhaps one of our most important decisions in our career? It feels like we leave a lot to chance. A lot of us will go into medicine with that goal of, I want to become a doctor. Once we graduate, once you start your practice, then what? When I was asked to talk to this webinar about postgraduate training, it's that angle that I chose to look at it from. And so tonight, what I will do is I will break this down to the bolts and nuts to just make sure that going out of this meeting, every one of us should be clear what options are available in terms of postgraduate training within medicine. A lot of if we're looking at the Zambian scenario, which I think I've been asked to look at, the university, I think the history speaks for themselves. Every one of us has been to one university or another. I think there we're almost well covered. The issue will come in because ZACOMS is the new kid on the block. So I will spend a bit of time explaining ZACOMS. The bulk of this talk will focus on the differences between academic and professional qualifications. I do understand, again, I've already indicated this, by being a doctor, we have gone through the academic route of training. So I don't expect us to have any challenges there. What I will do is elaborate a bit more on the collegiate training model. And with this, I will also go into some strategies that are used within ZACOMS to help in terms of quality assurance, in terms of our products. Now, one more thing before we go into the talk is what exactly is making me speak on this subject? Why do I think I qualify to speak to distinguished ladies and gentlemen on this very important subject? Firstly, I have been a student in the 3 different models that are available in terms of postgraduate training. I've trained under the Master of Medicine program. I've trained under a fellowship program. I've also trained under a Master of Science program. So that with my personal experience alone, I should be able to handle this topic, I think, quite fair. But I've gone further. I have been, and I am still actually, a lecturer, a trainer, and an examiner in all the 3 different models with various institutions. So again, I should be comfortable to speak to you from the position of one who is actually a trainer, a lecturer, and examiner on all these three different models. Crown it all, I'm actually a medical education expert, so I can still call upon that aspect of me to speak, I think, very comfortably on the subject at hand. What I've done is broken down, I was told I have about an hour to do my talk. I've broken it down into 4 small talks, just so that we focus our discussion on all those areas. Now, you will understand, as we are teachers, so that's how we will proceed with lectures. What I will ask, as Dr. Mwila was saying earlier, is that if you do have a question, please let's take note of that question. During the plenary, we'll take as many questions as possible. I will try to ensure that I make my presentation within reasonable time, again, so that we just avoid, so that we have time for discussion. I'm just trying to put this thing okay. Let me see if this does it. Okay. I would kindly request Dr. Mwila, or Dr. Ngwira, if you can confirm that my screen is visible.
Yes, it is visible. We can see it.
Okay, thank you. So to get started, I will quickly run through the history and mandate of ZACOMS, fully knowing that there might be a few people who might not be aware of the new kid on the block, as it were. And this first lecture will look at, basically give a historical background to how ZACOMS was established and the mandate that ZACOMS has. Will form the key talking points within this first lecture. Now, ZACOMS was introduced to become a pillar within the space of specialist training. A pillar because before ZACOMS was on board, there were other avenues through which specialists in this country were trained, as we will see in the next slide. All these were done in different platforms using different models, and ZACOMS was basically coming on board to provide a different training model with its own route. The idea on creating ZACOMS was to strengthen Zambia's health workforce. As you will see, one of the key strategies used within ZACOMS was to leverage off the resources that MOH and Zambia Medical Association had to create a specialist training program that is robust enough to meet the needs of the country. What led to this was actually a critical shortage of specialists. In 2017, Zambia Medical Association, the Health Professions Council of Zambia, and the Ministry of Health signed an MOU, basically trying to address the critical shortage of specialists in this country. In signing that MOU, they noted that the existing interventions were inadequate. Yes, postgraduate specialists were still being produced in this country, but at numbers that were nowhere near enough to meeting what this country needed. So it became clear that there needed to be a new way of approaching this old problem. Another problem that needed to be solved was the inequitable distribution of specialists. In 2017, most of the specialists this country had were along the line of rail. To be specific, Lusaka and the Copperbelt, most of them. Very few were present elsewhere. It meant that a Zambian who needed specialist care had to find their way to Lusaka or Ndola, perhaps even Kitwe, to access specialist care. This is a scenario that left huge chunks of this country underserved. It's against this background that ZACOMS was born, created under the Health Professions Act to come on board with a mandate of training specialists, to not only train them in adequate numbers, but also to help with the equitable distribution of specialists. As we'll see during the course of the presentations this evening, one of the strengths of the collegiate system, as offered by ZACOMS, is its distribution of specialists. This is a model that aligns with Zambia's disease burden and service needs. And this will come clear as we go into the next presentations that come. Since 2017, ZACOMS has grown to now running 21 different specialty programs. We have accredited training sites, 36 different hospitals. We have introduced examinations that are structured, aimed at ensuring the quality of our product. In working in this space of postgraduate training, we have also leveraged off hugely on existing and even new collaborations or partnerships with various associations locally, abroad, universities, the Ministry of Health. As you will see, ZACOMS has come on board to expand specialty and subspecialty programs and boost in terms of the numbers that this country is producing in terms of specialists. Core responsibilities within ZACOMS has been to develop this curriculum, to coordinate postgraduate medical and surgical training, to accredit various training institutions and clinical sites. And I've already alluded to the fact that we have the 37 different hospitals. We are present in all 10 provinces of this country. We conduct examinations and assessments at the central level, meaning that even if you are being trained in Kasama, we expect you to meet the same standard as that doctor who's being trained in Ndola, or the one who's been trained in Chipata, or indeed the one training in Lusaka. Additional functions have been to certify these trainees, to promote research and professionalism, to support continuous professional development, and to ensure quality and standards in specialist training. All these will be a bit more elaborated as we get further. Our national priorities have been not just to increase the numbers, but to help in terms of placement of these specialists. So by producing specialists for the national service delivery needs, by enhancing retention of highly skilled professionals, by reducing costs of training, because our training is locally as opposed to training abroad, by supporting equitable access to specialist services, and by strengthening academic and clinical leadership. ZACOMS and our STP program have worked to align with the national priorities in the healthcare sector. One of our key partners has been the MOH, and I just need to pause and say a few things about this. In the model that we are using for our specialist training program, we anchor our training on MOH facilities and resources. They are involved in recruitment and deployment of these trainees. They will manage study leave, bonding arrangements, and even sponsorship for training for these trainees. Supporting training sites, aligning workforce planning with specialist training outputs. And if you think about it, in the end, MOH is our main user of our products, and therefore they're a key stakeholder to what we are doing within the Zambia College of Medicine and Surgery, ZACOMS. Our collaboration ensures that we have timely submission of trainee documentation at the start of the training program, duration of the training program, and at the end, there's an accurate tracking of specialist cadres. We ensure conducive training environments, supportive faculty development and rotations, strengthening data flow for workforce planning. Clearly, the picture I'm trying to paint here is that ZACOMS is within the space of the Ministry of Health trying to address a critical area of human resource for health. This slide is just there to show us where, as ZACOMS, we are heading. We're looking at the expansion of specialty and subspecialty programs, digital learning assessment systems, further collaborations locally and international, faculty development and mentorship systems, and establishment of centers of excellence. During the last talk this evening, I will elaborate a little bit more about the Center of Excellence and the concept that it brings to training specialists. I thought, as I conclude on ZACOMS, just an overview of ZACOMS, I also mentioned this. Our vision is to become a self-sustaining world-class postgraduate medical training system that produces competent, ethical specialists for Zambia's health needs. The first talk, I was just making sure that we understand where ZACOMS has come from and how we have grown to become one of the leaders in terms of specialist training within this country. MOH and other universities are key partners in the mandate that we carry as ZACOMS. Together with all these key partners and stakeholders, we can become a stronger, more resilient health system by working together. Okay, that was the first, just to give you an introduction to ZACOMS. Let me zero in on the differences between academic professional qualifications. I think as we look at our future and we're choosing areas to specialize, we're looking at what are the different types of training programs available. This is important in as far as our human resource for health workforce is concerned, as well as in our own training programs. As ZACOMS, as the various universities, we are training postgraduates, I think it's just fair that we understand where this is coming from. In terms of postgraduate qualifications, and I think I alluded to these three types as I was making an introduction about myself. There are basically three different qualifications one can attain as postgraduate qualifications within medicine: the Master of Science, the Master of Medicine, or indeed a fellowship, a specialist fellowship, to be specific. The first two are what is called academic qualifications. Fellowship, on the other hand, is a professional qualification. This talk will differentiate between these academic qualifications and the professional qualifications, just to give us where we are. So let's start with academic qualifications. Now, like I indicated earlier, if you're a doctor, it means that you have gone through a university program, and therefore you have been at undergraduate level, been introduced to the academic route of training and have attained, therefore, an academic qualification. This route of training is the same which is going to apply when we look at your training postgraduate level. The focus in academic training, as we all know, is on theoretical knowledge. It's based on attaining qualifications according to the various disciplines that conform or that comprise to a given specialty. This is awarded by universities and some academic institutions. To the best of my knowledge, we do not have in Zambia an academic institution that is offering these postgraduate academic qualifications, to the best of my knowledge. But the qualifications you attain here, like your master's degrees, your PhDs, are all in this realm of qualifications. The academic qualifications will emphasize on research and theory. They usually have a shorter duration of study, and most programs will run for about 4 years, 3 to 4 years. There are some that will go into 5 years, but the majority of them will be for 4 years. Like I've indicated, this is broad-based learning, ensuring that the various disciplines within a given or specified field have been covered. Academic qualifications will form the foundation for further academic progression. So if one desires a career to go on and become a PhD holder, to become an academic PhD holder, I must specify, to become a professor within a university, this is the route that you are following. It's an academic route. It's based on acquisition of qualifications by attaining the different disciplines within that field. Let's talk about professional qualifications. These are focused on practical skills and competency. I've always thought of this as a training program that is based on the concept that as a specialist is working, there within that same field they have enough to train another person to become like them. So as they go by doing their day-to-day work of a specialist, they are also training somebody else. So communities of practice will form the professional bodies or councils that will be the awarding bodies. Examples are the specialist fellowship, memberships, or board certifications that we know. If you have heard people introduce themselves as a Mr. Sitali, those are people who have qualifications from this route of training, fellowships. The professional qualifications will be based on competence. What we want you to show within this competence-based training is that you can handle infections in bone, you can handle arthroplasties, you can handle trauma, you can handle tumors, musculoskeletal, everything relating to your field of orthopedics should be covered. The same will apply to pediatrics, obstetrics, and the like. So in terms of assessment, therefore, this is going to be assessed using a workplace-based assessment methods. And the next slide will give you examples of that. But basically, the same concept of as one is working, they are training another person to become like them. And therefore, as this person is training, you are also assessing them on the work. As you can imagine, this will usually be longer, modular, skill-focused training. The years in which one will take to train under this model will vary from anything from 3 to about 6. There are surgical programs that go in and train for as long as 8 years of training. The focus here is on competence acquisition. Therefore, it's directly linked to job performance. Let's look at some key differences. Whereas the academic will focus on acquisition of knowledge in the disciplines, will focus on the theory, will focus on the academic or scholarly acquisition. The other is focused on work-based, on performance, on practice. Dissertation or a thesis is almost compulsory within the academic route. Competence is the focus when we look at the professional pathways. The two qualifications are complementary. Academic qualifications will provide the foundational knowledge. Professional qualifications will ensure practical competence. It's not surprising, therefore, that in several countries where these type of qualifications are on board, you find that the collegiate system will be responsible for your day-to-day training. When it comes to your examination, you take that collegiate exam, and the university will then give you that dissertation pass to give you your Masters of Medicine. That is the model that we dream that one day, even in our country, this is what is going to be the way of training. Because you find that these two qualifications are actually complementary. Both are essential in running a healthy training ecosystem. Both are essential. In terms of trying to understand, I think, the differences, again, your Master of Medicine, Master of Science are all academic qualifications. Your fellowship is a professional qualifications. In terms of training, your academic qualifications are both attained within the university context. What is different between the two is that in a Master of Science, you don't have clinical component. So here what is focused on is scientific inquiry. You will know, or you will be exposed to all the science in a given specialty or given field without clinical component. The Master of Medicine will come with that clinical component and mastery of that. We'll rely to go further and look at various clinical domains. Various clinical domains. Various clinical domains, and it's these domains that then define the various competencies that people will be looking at attaining. Your Master of Science will be trained in a classroom or research unit, and it's those kind of jobs that you are looking basically beyond qualification. Very important qualification in research, within academic departments, within policy formulation and planning, very important. When you come to the Master of Science, it's offered within the clinical space in teaching hospitals, in clinical departments, and various rotations are done. The fellowship is done within a specialist clinical unit. The key issue here is that you are training by apprenticeship with a specialist and therefore have access to a specialist unit as your training base. A little bit more in terms of training, just to put it into a table for easy visualization. The 2 academic qualifications plus the fellowship and the differences in the training model, where mentorship, research, clinical work is what is obtaining within the fellowship line. The duration of training, as we have already discussed there, and then the thesis. So even though a thesis is a requirement within the academic space, it's not a requirement within a fellowship. But please note, even in the fellowship training, you will still be required to learn or to train research methods. In terms of progression, your Master of Science can give you academic progression, progression through research, and that line. Master of Medicine is a clinical position, academic position, specialist registration in that line. Whereas in the fellowship, it's specialist registration, clinical position. That's the route that one is taking in as far as career progression. Then you have workload, basically indicating the different ways in which the different qualifications are appreciated at the time of work. I think the question that begs to be answered at this point is, which qualification is superior? And many a time I've been asked this question, and I thought it's important that we address this. I think the best way to answer this question is to go back a step or several steps backward and ask, how do we tell, or how do we know that one who has a diploma, aside from medicine, if one has a diploma, how do we know that they are lower than one who has a degree? How do we tell that one who has a grade 12 certificate has a lower qualification than one who has a TVET certificate? How do we tell? How do we make these judgments away from what we're just discussing? It's the same way when it comes to looking at these 3 qualifications, Master of Science, Master of Medicine, and the fellowship. It's the same way or the same approach that we need to adopt. And that is by looking at what is called a qualifications framework. In Zambia, the qualifications framework is governed by the Zambia Qualifications Authority, ZACOMS. If you did Google ZQF, this is a table that would come. It's a table that shows you the weighting of the different qualifications. All qualifications within this country are placed on this scale or framework. You will find that at level 10, the highest qualification is a doctorate degree. Level 9 is a master's degree. Level 8 is a postgraduate diploma, and all the different qualifications go on in that fashion until you get here where you find your grade 12, your grade 9, and so forth. But all the different qualifications, and this is not unique to medicine. It's qualifications in law, in teaching, in engineering, name it. It's all the different qualifications that are placed on this scale. Now, what places a qualification in a given level is what are called descriptors. And I zeroed in on level 9 because it's level 9 that the qualifications for ZACOMS, our specialist qualifications for. This is the same level on which the Master of Medicine qualification will also fall. So you find that the level itself comes with what are called descriptors. It's these that place your qualification in one place or another. So the qualifications that are at the same level are said to be comparable qualifications. Please note, the language is comparability, comparable qualifications. Now that means that whichever qualifications is in level 9 should really be taken as the same qualification for the purposes of appraisal at your workspace, for registration as a specialist, and so forth. It's the same space. Now, this is also an important place to note that, you know, these qualifications framework will be different from country to country. Like I've indicated, in Zambia, our qualifications framework is ZQF. A qualifications framework elsewhere will also come with its own name, with its own descriptors per level descriptors. Now, the importance of ZACOMS attaining ZACWA accreditation is that we have ensured that our qualifications, therefore, are going to be universally accepted. You will not get a scenario where you go to a different country and they'll tell you that your qualification is lower than 9. That is the importance of getting ZACWA accreditation. Now, what I've just shared is an important concept to understand for those of us in training institutions, for the purposes of supervision, for assessment and certification processes. But like I've indicated, it's also an important concept for people who are managing HR systems in terms of placements, of making decisions for appraisal, for promotion, and so forth. In the context of our discussion this evening, it's also important for our colleagues who have not yet decided which career pathway they want to take, because now they know the different pathways in terms of academic route, professional route, and they have an understanding of what level they will be attaining and what options are available to them at that point. It's important from this talk that we appreciate the complementary qualifications, that these are both essential. They form an integral part in terms of career pathway. And all of this is going to inform us in terms of aligning our training and employment processes with the different qualifications on board. At the collegiate training model a little bit more, because again, I'm zeroing in on this model because my understanding is that from our academic background, the academic route of training, I think it's well known. We know what you get. We know what you're going to expect. because it's the same representation, more or less the same representation as when you get to your postgraduate level, be it a Master of Science or a Master of Medicine qualification. The collegiate model, to those of us who have not yet been through the system, requires a little bit more in terms of introduction. So let's zero in on this concept a bit more. Here, we will introduce this collegiate model and perhaps clarify a few things in regards to training and supervision, and highlight some assessment expectations and look at how this model strengthens national alignment in postgraduate training. So what is this so-called collegiate training model? It's a competence-based model. It's driven on the concept that where one is working as a specialist, they have within that space enough to train another person to be like them. The training, therefore, is focused on outcome achieving frameworks that are defined by the different communities of practice. So when you say that you're an orthopedic surgeon, it's not the Zambia Orthopaedic and Trauma Association that has even defined the various competencies. These are competencies defined by community of practice the world over. The Zambia Orthopaedic and Trauma Association will be leveraging off what is known worldwide. So the standard that you will need to meet from these colleagues will be that framework that is defined by communities of practice. A nationally harmonized curricula ensures that in whatever position or community that you are training, you are still attaining the minimum requirements within that particular community of practice. This calls, therefore, for a lot of responsibility from the different colleges and training sites. Progressive autonomy for the trainees is the order of the day. Because where you are, joining this program as a trainee requires that you then embrace the training model and push forth from that perspective. The key components here, so structured supervision. You cannot train under a competence-based program like we are training in ZACOMS without attachment to your specialist. Work-based placed learning. As you are seeing patients, as you are operating in theater, doing clinics, major ward rounds, that is where the training is occurring. So don't expect to come and be seated in a class and somebody today we're talking about diabetes, and they start telling you about the epidemiology, the clinical presentation, pathophysiology, and so forth. That's not it. What we expect is that in the scenario you are working, the places where you are working, that is where your training is occurring. Yes, it will be supplemented by lectures, by discussions, and other ways of interaction. But your main focus for your training, the jewel, the centerpiece of your training, is what is happening in that workplace. Key to competence model of training is continuous assessment. This is the one assessment that you cannot do without. Quality assurance and accreditation are key because the different training centers that we have are powered differently. So we'll need a system, therefore, that ensures that there is going to be equity in terms of access to resources for training. And this is one of the points that I'll be raising in our last talk this evening. It's a short one. National examinations have already alluded to this by saying we're trying to ensure that the standards of your training does not vary according to your training site. We expect you to meet the same standard as one who is training in a different site. Key to a competence-based training is supervision, direct, indirect, and oversight supervision where you are placed, defined supervisor trainee ratios, and these will vary from program to program. You find that there are those programs which require very low or can tolerate a higher number of trainees, whereas others will require a minimum number of trainees. Scheduled feedback is key because side by side with that continuous assessment you are getting is your feedback. Remember, this is a formative assessment. So we want to make sure that as we are going by, we are also ensuring we are closing down some angles. Documentation forms one of our key encounters in terms of training. What this means for trainers is that, first and foremost, we cannot do with assessors for training. We require increased responsibility to the clinicians or trainers to conduct work-based assessments. For this to work, you need consistent feedback, coaching, and I suppose I should have added there mentorship to our trainees to participate in college Q&A, quality assurance processes, to uphold professionalism and ethical practice. Many other times that we've had challenges with the last point here, where people are just thinking a training program is just to pass an exam, turn up and write one test or conduct another operation. No, it's everything. In our competence-based model, in the professional training model, professionalism, ethical practice, integral to what we are doing. It's a whole way of conducting yourself as a specialist that is under assessment here. For trainees, this means that they will need to have a progressive entrustment in terms of their own academic progression, active engagement in learning. And the words that we often hear is that these are trainee-led programs. Maintaining logbooks and portfolios, I've already alluded to this. Feedback, proactivity, again, I expected from trainees. Demonstrating professionalism is coming up there again because of the critical role that it plays within this way of training. In terms of assessments, this is an assessment of competencies. Remember, our focus in training is on outcome. It's not about whether you can describe, explain. We want to show that you can do. Formative tools are those strategies that we are going to use in training, in conducting work-based assessments. Of course, then, in addition to those formative assessments, under the collegiate system, we then have what are called summative assessments in part 1 and 2. These will then conduct your formal theory exams, OSCEs. In some places, there's to use long cases and examination, not of a dissertation, but of discussions, vivas, not dissertation, but vivas. The national standardization and moderation to avoid, rather to ensure quality with regards wherever the primary training site is. In terms of quality assurance, other things that we've put in place, site accreditation and reaccreditation. And this is not just within ZACOMS itself, but also by the regulators, Health Professions Council of Zambia, the Higher Education Authority, and to some extent, even the Zambia Qualifications Authority. Then training of these supervisors, moderation in terms of external examiners, and then trainee feedback systems, because this is a trainee-led program, and therefore their feedback is also very key in improving what we're doing as a training program. Annual reviews of program or annual reviews of progression for the trainees, so that whichever year the faculty will sit down with their trainees and establish if the goals for that particular year have been met, and identify, therefore, those trainees that have met the minimum requirement to progress to the next academic year. That's what will be happening. That's what happens under the review programs. All right. In terms of winding this aspect up, the collegiate model, strengthened specialist training, is focused on those assessment and supervision. A collaboration between ZACOMS, the various training sites, and supervisors is key. Commitment to excellence ensures a competent, confident, and a specialist workforce. I will, at this point, take the last short talk, and this one is short. This one is short, the last talk, just to talk about one strategy that is frequently used in postgraduate training, and especially within the competence-based training, which is the role of inter-facility and inter-provincial training rotations. We've already covered this mandate, and what we want to talk about here is really rotations as a model, as a means to quality assurance. Why do these rotations really matter? They matter because there's no single site that really provides all different competencies. Strictly speaking, there's no single site that does this. So the more diverse environments the trainee is exposed to, the greater the chance they are going to access the competencies that we desire. Furthermore, this is a strategy to ensure there's equitable access to limited training resources. There are these places which will be in remote, in rural areas that might not have some of the state-of-the-art equipment that we can simply package in small rotations and ensure that we attain those competencies. Further to this is a variation in institutional strengths. The key to being a specialist lies in the volume of work that you handle. The more cases you see, the wider variety of the cases that you see, the stronger that you are. So these are reasons that will make us want to move trainees from one site to another to sort of increase the strength of these training programs. Again, as specialists, our strengths will also vary. So we don't want a scenario where you're going to train your 4 years under one person. You just learn what that person knows. But by exposing to different competencies, you again get a more rounded specialist. So you are getting exposed to equipment, to diagnostics, to theater capacity, to technology, name it. At the end of the day, what we're really trying to do is make sure that there's a full competence spectrum that is being attained. You have been exposed to rare cases, complex procedures, and have seen diverse pathologies during the course of your training. By the way, if you look at the global standard, this is the norm in terms of a competence training. Multi-site exposure is an example of best practices within medical education. International benchmarking also entails, therefore, that we follow this same strategy in executing our mandate for ZACOMS. This ensures that we build a well-rounded, a confident trainee, building on resilience, adaptability, and making sure that there's readiness for deployment. Provincial equity distributes the specialist presence, strengthens provincial systems. And as a college, we then work with our key stakeholders and other institutions for training to ensure we leverage off the best resources that this country has. In terms of quality assurance, again, this reduces variability in training, ensures that all the trainees are exposed to the best services available. By doing so, we yield competent, confident, adaptable trainees or specialists that are ready for independent practice. The benefits to the country are obvious. A stronger workforce, improved service delivery, and we build on public trust. These rotations are essential to executing of a competence-based training program as we are doing. This ensures that we have exposure to best practices and have invested highly in high quality and in equity in terms of access to the various resources for health. All right, that was my talk. And I will at this point hand over back to the moderators, Dr. Mwila.
Thank you very much, Dr. Sitali, for those presentations. Very informative indeed. So we are going to go into the plenary session where we'll be taking sets of 3 questions at a time. I have taken note of a few questions from the chat box. I'll start with these ones. So Dr. Chimukamleya is asking if a postdoc one attained after PhD is a recognized qualification. Then Dr. Imanga was also asking if subspecialty post MEd is it still a level 9 under the Zambian qualification framework? And also asking if someone with a professional qualification can teach or become a lecturer. So that's our first set of questions.
Dr. Mwila, sorry, the first question, I quite didn't hear it. Sorry.
The question saying, is a postdoc one attained after PhD a recognized qualification? A postdoc after PhD.
Okay. Okay. Thank you for that question. I think in terms of what we are discussing, that one is out of the scope of our discussion. Sorry, Doc. And I will have to examine exactly, if I were to answer it faithfully, I would need to examine to look at exactly what is contained there for me to answer. Dr. Mwila, you did indicate there were 3 questions.
Yes. So the second question, Doc, was about subspecialty post a Master of Medicine. Is it still a level 9 qualification under the Zambia qualification framework. And the other question was, can someone with a professional qualification teach or become a lecturer?
Now, I hesitate to give you a blanket statement there because I know that the subspecialty trainings are many. So that, yes, there are some who are there and they are level 9, but there are some where are subspecialty training, but they're actually postgraduate diplomas, and they will be therefore at level 8. What you need to do to understand where a qualification sits is to examine the curriculum for that particular qualifications. Don't be fooled or misled by things like this is a Master of Science qualification, or this is a fellowship qualification. Examine what is contained. If you're not sure, you can ask our colleagues at ZACOMS who will guide you in terms of where this qualification will sit. Can one who has a fellowship qualifications teach? Yes, they can. And I think we should have seen, even in this country, some adverts for universities that were accepting people with, with a fellowship programs. And if you think about it, those of us who were trained even at UNZA, even in our time we were training, we had people who had such qualifications teaching us. So it's not something new. But then what happens in the academic space is usually that they will need to take some bridging courses that they will need to go with their other qualifications for them to be suitable at that level of progression. What you probably want to know is that where we are now, the world has even moved on. We even have PhDs that are professional qualifications, where it's nothing to do with the academic route. It's all about competencies, and people have gone on to become a PhD holder in that space. So things have evolved beyond where we were maybe even 10, 15, 20 years ago. That is with two questions I think I've answered. Yes, Dr. Mwila, I think I've answered.
Thank you very much for those responses, Doc. Colleagues, please let's feel free to interact. We can have another set of questions, 3 questions. Anyone with a question, you can feel free to raise your hand, or you can go ahead and unmute yourself and ask your questions. Dr. Moyo, please go ahead.
Good evening. This is Crispin Moyo from the Healthcare Federation of Zambia. And thank you very much for this very educative and enlightening presentation. I know quite a lot about ZACOMS, and I know the battles that we fought. And congratulations, Dr. Study and your team, for putting ZACOMS where it is today, recognized by ZACWA, but also fully established under Higher Education Authority. Thank you very much for the hard work. However, I want to also just ask whether ZACOMS is prepared for the private health sector, which, as you may well know now, has been recognized as one of the three major providers of health in Zambia, one being public sector, which is government, the second one being faith-based, anchored by church, and the private sector anchored under the Healthcare Federation of Zambia. However, we find that it's very difficult for our members in the private sector, to take time off and upscale or upskill themselves and become specialists while continuing to practice in private. Is there room within your ZACOMS framework and modus operandi to bring on board private sector providers to specialize in the various fields where they would want to specialize? I submit. Thank you so much.
Okay. We can take two other questions. I don't. Yes, please go ahead, Doc.
All right. My name's Dr. Howard. I'm a junior resident medical officer based in Lusaka here. So I have a quick question on the paradigms of specialist trainings and their key differences. I noted on the part where it was mentioning eligibility for those doing Masters of Science in MEd and fellowship, it showed that the minimum requirement for you to pursue those different specialties was a medical degree in all three of them. So my concern or my question is, is it possible to jump from your medical degree directly to do your fellowship, or you need your master, your MEd or your Masters of Science for you to be eligible to do your fellowship training? Thank you.
Okay, thank you very much, Dr. Howard, for that question. Maybe we can take one more. Anyone with a question? Okay, I'll pick one from the chat. This one is coming from Samu, who is asking if one can enroll in both a Master of Medicine and fellowship program simultaneously. Over to you, Dr. Sitali. So we have a question about the private sector, how to bring them on board. Then Dr. Howard is also asking about eligibility for these courses. Then we have another question that is asking about taking the different streams simultaneously, taking the fellowship simultaneously with the Master of Medicine. Over to you, Dr. Sitali.
Thank you, Dr. Mwila. Dr. Moyo, greetings, sir, and thank you for those nice, lovely comments. I do indeed remember those good old days. Let's call them that, the good old days, yeah, in the early years of ZACOMS. Brilliant question, sir. Now, I'll tell you, sir, that we actually already have private sector on board. In the last 4 years of our ZACOMS STP, we've been running programs at Nchanga South Hospital in Chingola. It's a private hospital, one of those 9 hospitals, and we have trainees at that particular facility. I'll tell you that this year, we've signed an MOU with Coptic Hospital in Lusaka to commence training programs there. We've signed, we're still in the processes of finalizing an MOU with Fairview Hospital, again in Lusaka, to do the same. Now, the private sector is a unique place. We have human resource there in terms of training, but look at the equipment, the facilities that are there. Some are things there that even our government hospitals don't have. I'll tell you that when this opportunity came to collaborate with the private sector, we were very happy, because now it means that even our trainees can go and rotate there and gain further access. This is what I was talking about in my last talk, when we were talking about the rotations and how this is an important step in terms of quality assurance. So yes, by all means, if there are any private facilities that want to bring us on board, we are open, and we're looking at how we can bring many more such hospitals on board. Now, of course, we have to be alive also to the fact that the strengths of these hospitals will vary, so that we should also be alive to the fact that if we are going to train, we need to actually innovate even further. Now, those are discussions perhaps that are beyond the scope of this discussion this evening, but I'm ready to engage you, Dr. Mwila and you, Dr. Moyo, sorry, and your team, so that we can see how we can collaborate even at a higher level than we are already doing. I think that's a positive step. Dr. Howard is asking about whether one can go directly from a fellowship, from MBCHB to a fellowship program. I get the feeling that the concept of the fellowship is not really being appreciated from the question. I may be wrong, but that's what I'm getting. Because if the concept of the fellowship, as I've discussed this evening, is that they are at par with the Master of Medicine, then that question doesn't arise. Because the same way that one qualifies to move from MBSHB into an MED program is the exact same way that one moves from MBSHB to become a specialist registrar in a fellowship program like we are offering. Oh. So it's the same. Okay? In terms of what happens further. Now, at the level of exit, one who has a specialist fellowship and the one who has a Master of Medicine, like I was showing in that slide for the Zambia Qualifications Authority, you are considered to be at level 9, the same level. It's those super specialists beyond that qualification that may come with a requirement that you need to have attained this level 9 qualification before you attempt them.
Oh.
All right. I hope I've helped Dr. Howard there. There's somebody who sent a message and was asking about, can somebody enroll in MED and a fellowship simultaneously? Yes, by all means. In fact, that is the model that South Africa is using, as I said in my lecture. In South Africa, when one goes to train as a specialist, you are enrolled dual with a university of your choice, but with their ZACOMS equivalent. The people who are responsible for your training, day-to-day training, your progression within the training program, it's the ZACOMS equivalent, their fellowship program. When you get to the end, here, you have finished, you're writing your part 2. You have the decision to make of whether you're going to just write the college exams and come back to Zambia as a specialist holding the fellowship from South Africa, or you, after passing that, go further and do a dissertation with that university of your choice. Now, previously, the progression within the university rule was not so strict. You'd find that some people just progress with their fellowship and come back. But as of, I think, 2 years or 3 years now, they have changed the rules there. You find that now you need to register with both the university and you need to be paying the fees for university as well as for the college for you to come and get your qualifications at the end. That is where we are. And in our setting, we have a lot of people that have dual enrolled. There are those that have enrolled with universities locally, and I know that there are some people who are enrolled with universities locally, but are doing fellowship, a similar fellowship, maybe a regional fellowship like COSISA, for example. So this is pretty much accepted. Thank you. I hand over to Dr. Mwila.
Dr. Sitali. So there are two questions in the chat. I'll combine the two, where they are asking about scholarships to do STP. Are there scholarships available for those that are coming from the private sector or coming from the government? There is also a question about rural posting. For one to qualify to do the STP program, do they need to first complete their 2 years of rural posting?
Thank you for those two questions. Do we have scholarships? No. We have, for those that are GRZ employees, taken the view that all GRZ employees are being paid for by GRZ. So you find that we will not give you quotations for fees like a private, one who is coming from the private sector. So even those that have come in, as long as you're a GRZ employee, you have come onto our books, we'll take it that, of course, and that's the position for most of our trainees. The paperwork is still following. So we work with the HR officers, with the other key stakeholders, ZMA, RDAZ, and see if we can get you government sponsorship. Now, for those that are coming from the private sector, unfortunately, as at now, we do not have any scholarships. But the incentive that we have is that our fees are, first and foremost, way reasonable. Way reasonable. I don't think you can find the kind of training we're offering and the fees that we are charging. I challenge you to find somebody who's going to ask you to pay less. But even for these really economical fees, we still allow you to pay in installments. That is how far we've gone in terms of incentivize our colleagues in the private sector. Is rural posting mandatory for ZACOMS? No. It's preferred that trainees who have done rural posting. But remember, ZACOMS is not just bringing on board trainees from Zambia. we have foreigners, we have people from the private sector, people who are paying for their fees. So we cannot have a rule which sort of picks or chooses different approaches to trainees. Our rule is that you need the minimum full license with the health professions of your choice, and as well as your medical degree to come into our programs. Now, where the vetting comes in terms of rural posting is from the GRZ SECO, because we know that if you're a government employee, our regulations are that you will need to have done rural posting. So your human resource, your workstation is not going to perhaps allow you to come into the program without that rural posting. Now, again, a bit of context here. Some of our training sites are actually already rural. So that, I'm saying this because there have been PhDs, medical superintendents who have actually called us to specifically ask some of their trainees to be retained for training because of that same concept. So you find that this is a rule, therefore, that will, on our end, we will bring you on board because you have the minimum requirements, and we will allow the powers that be in terms of HR, your human resource, your hospital, to decide if they are going to allow you to join the training. Thank you.
Thank you very much, Doc, for those responses. I don't see any hands. Do we have some questions, colleagues? While people gather courage, I can go.
Good evening.
Yes, please go ahead, Dr. Kapi. Go ahead.
Thank you, Dr. Mwila, and good evening. Thank you, Dr. Sitali, for highlighting some of the pertinent issues regarding how someone should, for those who are intending to specialize. My question is regarding ZACOMS. I know for general surgeons, I think when they want to again have another fellow regarding getting the one for East and Central and Southern Africa, they are being exempted from doing their entry exams. Apart from the one for the general surgeons, which other colleges are we collaborating with, and which are giving exemptions when it regards if someone wants to do either super subspecialty or they just want to get another fellowship from another college? Do we have colleges which we are collaborating with as ZACOMS so that we can use the same qualification to further our studies regarding if you want to get a subspecialty or you just want to get another fellow from another college? Thank you.
Thank you very much, Doc, for that question. Can just add a few questions, Dr. Sitali, from the chat. Apologies, colleague, if I have not read out your question. My network keeps dropping, but I'm taking note of as many as I can. So there is a question about recognition of the STP qualifications internationally in other places like the UK. And also there was a question about if someone has a Master of Science, for example, in dermatology, can they be registered as a specialist? Over to you, Doc.
The first two questions are actually related. The issue with which college are we collaborating with for us to go on and attend these regional fellowships like the COSEXA. Then the second question was with regards to recognition. Is this qualification even recognized? When I was getting that question, I smiled to myself because it seems like I've been answering the question about recognition pretty much from day one of ZACOMS. It's always about recognition. It's always about recognition. And yes, let me start with recognition, therefore. What makes you recognized internationally, and I'm going to put this in inverted commas, is the status of your registration locally. So how are you registered here? Are you a specialist? Are you recognized by your Zambia qualification, by your qualifications framework? And is this an accredited training program by your higher education authority? So your registration status is where your HPCZ is going to fall. Then the other two are the bodies that I think I've already indicated. So how you are recognized here in Zambia is what determines what is going to happen to you when you go out there. In terms of recognition, I'll tell you, colleagues, that we have met the minimum requirements for international recognition. And because of this, I'm happy to tell you that we have trainees from pretty much all over Africa coming to train. We have people that have trained, some have even graduated already, from Swaziland, Zimbabwe, Botswana. We have people from Malawi. We have people from the South West African bloc, where Sierra Leone, Liberia, have trained with us. We even have, and I always make the point, we even have people who've come here from New Papua Guinea to train with us, just to tell you how well recognized our qualifications are. And then I also go further and tell you that we have our graduates that have gone pretty much everywhere. We have people that have gone for further studies, Japan, China, have gone in the USA, UK even. We have people who have gone to Israel, people that have gone to Germany to train with our qualification. Now, I think that answers the issue of recognition. And the basic principle, colleagues, is what I started by saying. How you are recognized in your country determines what is going to be done when you go out there. Now, Dr. Kapipi makes the question appear as if because of a special arrangement with the COSEXA, our graduates are exempted from doing. It's not that. It's not that. If anyone, like even from MED, if anyone got an MED qualification in Zambia and wanted to get a fellowship with COSEXA, all they would need to do is just apply. In my country where I've come from, I'm a specialist. I already hold a license as a specialist, and I would like to get your fellowship. Automatically, we exempt them, they go into the exam class. So it's the same concept of recognition that follows. So it's not because of a special arrangement with ZACOMS. No, it's not. I know we do have an MOU with COSEXA, but that is for totally different things, supporting our training and so forth. It's totally different. The same concept I'm telling you means that, and I know our colleagues that have gone to do exams with CANEXA, for example. That's the equivalent of COSEXA for anesthesiologists in Africa. Same arrangement. The other colleges are not well established to the best of my knowledge. But I'll tell you that the College for Physicians, also same arrangement. And in fact, that particular College for Physicians started after we already have produced specialists as ZACOMS, so that some of our first cohorts as physicians are actually founder members of that particular college. Again, that adds to what we are talking about earlier about recognition. So it's all there. So you don't need a special arrangement. So if at all there's any fellowship that you want to pursue, please feel free to apply to do their exam based on the concept that you are already certified as a specialist locally, and you will be accepted. Thank you, Dr. Mwila.
Dr. Mwila, are you still there? Okay. Well, thank you so much, Registrar ZACOMS. I think the discussion has been excellent. You have brought out a lot of key discussion points that needed to be addressed. And I think to the doctors, our listeners, and those that have had the chance to participate in the discussion, I've appreciated the value of the knowledge that you have brought to the forum. And I think for those who are deciding career paths, those who are just doing their internship rotations, those who are starting their postgraduate training, I think this is a discussion that you actually needed and has come at the right time. I would ask that we end the meeting here, Registrar, unless there are any burning points or questions that need to be addressed. Then I would ask that those questions, you can just come through. Maybe we can have last two burning questions, and then we give our registrar an opportunity also to go and rest. I think he has done much of what we wanted him to do. Do we have any burning questions? You can just come through and talk.
Good evening, Dr. Ngwira. This is Dr. Kamfwa.
Yes, sure. You can go ahead, Dr. Kamfwa. Thank you.
Yeah, I know the registrar has answered one or two issues from the previous question, but I think there's one part where the previous doctor who spoke had asked on whether the person who does an MSc program in areas such as dermatology would be recognized as a specialist or not, a Master of Science in Zambia. Because I do understand that with the Health Professions Council of Zambia, it has a certain criteria on which qualifications are registrable and are relevant to that particular field. So in this case, the question would be, is the association, both ZMA and of course, Health Professions Council of Zambia, recognize MSc pathway as a relevant qualification for one to be identified in Zambia as, or rather for a doctor to be identified as a specialist? Thank you.
Thank you, Dr. Kamfwa. Can we have one last question to the registrar? Okay. Dr. Stari, maybe you can address that. Then we close the meeting. Thank you.
No, the way it is this. Our specialist register is a clinical register. It's a clinical register. A MSc is not a clinical qualification. It's an academic qualification that is attained outside the clinical space. A Master of Medicine, a fellowship, like we're discussing a specialist fellowship, are clinical qualifications, so that the cadres who hold these two then can go on to become consultants on the ward and so forth. The people who will hold the Master of Science are not in that scope of a clinical specialist. For them, their pathway is the academic route, where there will be, yes, Masters of Science holders. They can pursue roles in academics. They can pursue roles in policy formulation, in research institutions, but not in the clinical space. Now, and I know that there are people who have this Master of Science who still find their way into the clinical space. Is it completely impossible? No, because for them to attain this Master of Science, remember that they're already doctors anyway. So that using their undergraduate qualification, they'll still have competencies to see in the clinical space. But they will be disadvantaged if you ask them to see at that level for a master, at that level for a clinical field. So those are different qualifications. Thank you.
Yeah, thank you so much, Registrar. And I know where Dr. Kamfa was taking the discussion. We have seen a number of colleagues who have Master of Science and have been registered, just like you have put it, Registrar. But I think this is also a question not only to the Registrar, but also to the regulator, which is HPCZ. And I think HPCZ themselves, obviously, they might have reasons as to why some of the doctors that are in that category are on the specialist register. It's a multifactorial kind of I think approach with regards to the regulator, but I wouldn't want to speak on their behalf. Registrar, on behalf of the Zambia Medical Association, I would like to thank you sincerely, and we are so grateful that you'd find time to be with us this evening. I know this is a discussion that obviously to some we may still need to continue, but unfortunately, the time that we had for this program has come to an end. And I want to just thank everyone that found time to be with us. ZMA will continue to bring enlightening programs, and I do encourage that we all participate as these programs are brought to us. Thank you so much for finding time, and most importantly, the registrar and Dr. Mwila, she has dropped off. But thank you also. I think both Dr. Stali and Dr. Mwila have done excellently well. And I wish we could clap for them, but definitely we'll find ways to appreciate them properly. Registrar, thank you and good evening, colleagues. We have come to an end and wish you all the best and have a good night. Thank you.